There's a common heart condition that affects millions of older adults, dramatically raises the risk of stroke, and yet in up to half of the people who have it, causes no symptoms at all. They're walking around with it right now, completely unaware. It's called atrial fibrillation, or AFib for short, and it may be one of the most important things for you to understand after 60. The good news, and there's plenty today, is that it's often easy to detect and very manageable once it's found. Here's why this matters so much. AFib is one of the leading causes of stroke, and a stroke caused by AFib tends to be more severe. But here's the hopeful flip side. When AFib is identified and properly managed, that stroke risk can be reduced enormously. So this is a condition where simply knowing about it and checking for it can be genuinely life-saving. We went through the research on AFib and stroke, and today I'm going to explain what this hidden rhythm actually is, why it raises stroke risk, how you can check for it yourself, and what can be done about it. So stay with me to the end, because I'll show you a simple way to check your own heart rhythm at home in under a minute that could one day reveal something your body has been hiding. First, let me explain what AFib actually is, in plain language. Your heart has 4 chambers, and normally they beat in a smooth, coordinated rhythm, the 2 upper chambers squeezing first to fill the 2 lower ones, which then pump blood out to your body. It's a steady, organized 1-2 beat. In atrial fibrillation, the electrical signals in those upper chambers go haywire. So instead of squeezing properly, they quiver and twitch chaotically. The result is a heartbeat that's irregular, often fast and disorganized. In plain terms, the top chambers of the heart stop beating in time and start quivering instead. Hold that picture because it explains the danger. Let's look at why this is so risky. Quick favor before we go on. This is potentially life-saving information, so tap that like button to help it reach more adults over 60, and maybe share it with someone you love. All right, let's get into it. So why does this quivering raise stroke risk so much? Here's the heart of it. When the upper chambers quiver instead of squeezing firmly, blood doesn't get pushed through cleanly, so some of it can pool and sit still in a corner of the heart. And blood that sits still tends to clot. If a clot forms there, it can then break loose, travel through the bloodstream, and lodge in an artery in the brain, causing a stroke. In plain terms, the still, pooling blood from AFib can form a clot that travels to the brain. This is why people with AFib have a substantially higher risk of stroke, several times higher than those without it. Understanding this makes the whole condition make sense. Now, the second crucial point is why it's so often hidden. We'll call it the silent rhythm. Here's the tricky part. A large share of people with AFib, up to half, feel no symptoms at all. The heart can be quivering away without them noticing a thing. When symptoms are present, they can include a racing, pounding, or fluttering sensation in the chest, a feeling that your heart is skipping or flip-flopping, unusual fatigue, shortness of breath, or lightheadedness. In plain terms, AFib sometimes announces itself, but often it hides completely. And that's exactly why you can't just rely on feeling it. You have to check for it. Stay with me, because the third point is the empowering one. You can actually check for this yourself. We'll call it the self-check. AFib makes your pulse irregular, so feeling your own pulse is a simple first screen. Here's how. Sit quietly, then place 2 fingers, not your thumb, on the inside of your opposite wrist, just below the base of your thumb, until you feel your pulse. Now, instead of just counting, pay attention to the rhythm. A normal rhythm is steady and regular, like a clock ticking. Beat, 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 evenly spaced. An irregular rhythm feels erratic and unpredictable, with beats that come too close together, then too far apart, with no steady pattern. In plain terms, you're listening for whether your heartbeat is a steady drum or a chaotic, stumbling one. Feel it now and then, especially at rest. If it feels persistently irregular, that's something to bring to your doctor. Many modern blood pressure machines and wearable devices can also flag an irregular rhythm, which can be helpful. And the fourth point is the genuinely hopeful one. What can be done? We'll call it the manageable threat. Here's the reassuring truth. AFib is very treatable. When it's diagnosed, usually confirmed with a simple heart tracing called an ECG, doctors have effective ways to manage the rhythm and, crucially, to greatly reduce the stroke risk, often with medication that helps prevent those dangerous clots from forming. In plain terms, once AFib is found, much of its danger can be diffused. This is exactly why detecting it is so valuable. The threat is large, but the protection, once you know, is powerful. So let's bring it together. Atrial fibrillation is a common, often silent heart rhythm where the upper chambers quiver instead of beating cleanly, allowing blood to pool and form clots that can travel to the brain and cause a stroke. It frequently has no symptoms, which is why checking your own pulse for an irregular rhythm is so valuable. And once it's found, it can be managed to dramatically lower your risk. Here's your takeaway. Get in the habit of occasionally feeling your pulse and noticing whether it's steady or irregular. Mention any persistent irregularity or symptoms like fluttering, racing, or unexplained breathlessness to your doctor. And keep up with your regular checkups, where a doctor can listen to your heart. Detecting this hidden rhythm is one of the most worthwhile things you can do for your stroke risk after 60. Now I want to hear from you. Tell me in the comments. Did you know you could check your own heart rhythm this way? And have you ever felt your heart flutter or skip? Be honest, because your answer might prompt someone else reading to check their pulse and maybe talk to their doctor. We read every comment here at Build After 50, and your questions often become our next videos. And before you go, if this helped, the next video you should watch is right here. It's about blood clots in the legs, the signs you must never ignore, which connects directly to today's theme of clots and circulation. Go watch it next. If you're new here, Build After 50 publishes research-based health videos every week, made specifically for adults over 50 who want to stay safe, healthy, and independent. Hit subscribe and turn on the bell so you never miss one. One important note before we close. Everything we share here at Build After 50 is for educational purposes only. It's grounded in research, but it is not a substitute for personalized medical advice. Checking your pulse is a helpful first step, not a diagnosis, and only a doctor can properly evaluate your heart rhythm and guide treatment. So please bring any concerns to them. They know your situation better than any video ever could. Here's the thought I'll leave you with. Some of the most important things happening in your body are quiet, even hidden. But with a little knowledge and a moment of attention, you can bring them into the light and protect yourself. Take the minute. Feel your pulse. Know your rhythm. Knowledge is your first line of defense, and you just added to yours. This is Build After 50. Keep building.